are new advancements in the field of plastic surgery, including enhancing the patient's safety with less cost. Here to tell us more is Dr. Andrew Wolin with Wolin Plastic Surgery Center. Good morning, Dr. Wolin.
Good morning. How are you?
I am doing well, and I'm happy you're here because I always get to learn so much when you are here.
Fantastic.
So tell me, what are kind of the newest methods of delivering plastic surgery?
Well, you know, in the past, everyone was having plastic surgery in an outpatient facility. They were undergoing a general anesthetic. It was a big deal. So I said, you know what? This should be much more consumable. It should be more like going to the dentist and having something done, and then you can get up and walk out without any problems. So that is what I try to do. I try to keep it extremely safe, and I try to keep it extremely efficient, and I try to keep it extremely easy.
Does this mean something like a breast augmentation can be done as an office procedure under local anesthesia?
Absolutely. In the past also, breast augmentation was a much more painful procedure, and it had to be done in the outpatient facility, and the patient had to go completely asleep. And now we don't need to do that. We can do this with the minimal amount of anesthesia, and we can do this with the minimal amount of sedation, and it works great. The patients get up.
We've got a before and after picture here.
Yeah,
it does work great.
And these people, they have the procedure done, and as soon as they're finished, they get up right up off the table and they walk out the door. All these people. This was somebody actually who had a deflation of a previous implant. I harvested fat from her, and then I added the fat around the area that was kind of crepey, and these are all done as office procedures, and patients just love it. They do fantastically well with it.
No kidding. That's incredible. Now, as far as post-op goes, I know that these are, there's still surgeries, there's still healing that needs to be done. Are there newer drugs out there to sort of help the patient ease the pain, maybe?
Absolutely. There are some new drugs. They're extended local drugs, and what I do is I always try to incorporate them into the procedure. So, and when the patient wakes up, they have no pain, and these medicines work for 24 to 48 hours following the procedure. So they go home and they have no pain, and they feel like this is great. It's like I went and had my teeth cleaned, and this is just great. That's kind of the way this should be. It should be simple. It should be safe and easy without undergoing a lot of drug therapy to get to the point that you want to get to.
This applies to surgeries like facelifts. This is the before and after here.
Absolutely, and these patients, they're fantastic. They come in, and we give them the little bit of medicine that they need, and then we can take extra skin off. We can fill their face with fat and do all these things. This person was actually done with only a straight little local anesthetic, where I numbed up the mouth, I lasered her, and I added fat to all of the areas to try to get the mouth to look nice and smooth. Very consumable, really easy to do. Patients up and at them, and out in the public in a very short time, because they don't have any of the normal sequela of the long anesthesia.
Right. Now, how do all these factors sort of combined affect the delivery and the safety of plastic surgery?
Well, I think the biggest thing that I'm really about is safety first. If it can't be done safely, then don't do it. So safety is the first real gold standard, and after that, it's efficiency and time, and making sure that the recuperative period is very easy for the patient. So the combination of those things kind of redefines what I deliver. And people, every single person says, if I would have known that it was this easy, boy, I would have done this years ago. And so it's a great thing, and I think it's a fantastic thing for the field.
Thank you so much, Dr. Wolin. I imagine this actually opens the door for those who may have been apprehensive about it in the past. So great information.
Absolutely.
Thank you so much for sharing.
Thank
So
you.
if you want to learn more about Wolin Plastic Surgery Center, AndrewWolinMD.com is the website. Head over there, or simply call the number you see right there on your screen.